13%. The 5-year survival rate for pancreatic cancer in the United States is 13%. A few years ago, it was 12%, so a 1% improvement. It's something, but not much. Currently, it is the 11th most common cancer diagnosis in the US and the 3rd most common cause of cancer-related deaths. By 2030, it is estimated to be the 2nd leading cause of cancer-related deaths. There are several problems that make pancreatic cancer difficult to prevent, diagnose, and treat. None of these are easy to solve. I'm Wanda Frazier. This is Your Body and You. Recent data for pancreatic cancer is often presented as estimates or projections. There is a lot of data. For estimates, it takes a few years to compile observable data like incidence and mortality. Projections for the current or future years are generally derived from adjusting for lag time in reporting, recent trends, and changes in population. Health organizations and governments need estimates and projections to plan their resources. Predictions. For 2026, it is projected that 67,530 Americans will be diagnosed with pancreatic cancer. 52,740 Americans are projected to die from it. For 2025, it has been estimated that 67,440 Americans would be diagnosed with pancreatic cancer. 51,980 Americans were estimated to die from pancreatic cancer. For the past 20 years, the overall incident rate for pancreatic cancer has trended up in the United States, but mortality rates have barely budged. In this graph, the incident rates are in blue and red. The mortality rates are in green. This image shows incident rates by state. The darker the color, the higher the incidence. So DC, Wisconsin, New Jersey, North Dakota, Louisiana, Michigan suffered the highest incident of pancreatic cancer. Age groups. The National Cancer Institute breaks down pancreatic cancer into 5 age categories. This is for 0 to 15-year-olds. This is for 15 to 39-year-olds. This increase in incident rates is sounding alarm bells for data analysts. This is for 40 to 6-year-olds, and survival rates drop off from previous age groups. This is for 65 to 74-year-olds, and this is for 75-plus-year-olds. So older Americans suffered the highest incidence and mortality. Seniors suffered the most from pancreatic cancer. However, researchers are studying why incident rates for younger adults is rising and why mortality rates are not improving much. Prevention and risk factors. Prevention and risk factors relate, so I'm going to talk about these together. There are risk factors for pancreatic cancer that cannot be changed. For example, age or a genetic predisposition. However, researchers are specifically looking at risk factors that may have changed in the population and are able to be improved. Smoking is one of the biggest risk factors for pancreatic cancer. However, from this graph, smoking rates are trending down for younger adult populations. However, obesity and diabetes are also big risk factors for pancreatic cancer. These are trending up in younger adult populations. Hopefully, research will show if these trends continue and whether they have implications for pancreatic cancer mortality rates. Anatomy. The pancreas. Most of it sits behind the stomach. During exams, doctors cannot feel your pancreas when they press on your abdomen. From standard tests, it is not easy to see either, so examination of the pancreas is not routine. Generally, pancreatic cancer is not diagnosed until it reaches the later stages. Stages of cancer are generally defined by cancer spread. This graph shows survival rates for each stage of pancreatic cancer in each category. Localized cancer is blue on this graph. It has stayed within the pancreas. It takes 10 to 20 years for localized cancer to develop into a tumor. Most of this time, there are no symptoms at all. Survival rates in this stage average 44.5%. Regional cancer is represented as green on this graph. It has spread locally outside of the pancreas. So the surrounding ducts, the local organs like the liver or the lungs. Survival rates in this stage average 17.5%. No age category reaches 50%. Distant cancer is represented as a pinkish light purple. It has spread further throughout the body. Survival rates in this stage of cancer average 4.3%. No age category reaches 20%. For ages 15 to 44, the data shows some unknowns. So hopefully this will give the data collectors some areas to clarify in upcoming data sets. Physiology. The pancreas in more detail. Different cells in the pancreas provide different functions. Exocrine cells make digestive enzymes that travel to the small intestines via the pancreatic duct. Pancreatic adenocarcinoma, PDAC, starts in the exocrine cells, usually in the ducts. Over 90% of pancreatic cancers start here. These are the most aggressive pancreatic cancers. They are generally diagnosed late because the early symptoms are subtle, such as jaundice, abdominal or back pain, unexplained weight loss, a diagnosis of diabetes. Other symptoms include fatigue and light-colored stools or dark urine. Endocrine cells make hormones like insulin and glucagon. These enter the bloodstream and help maintain glucose levels. Pancreatic neuroendocrine tumors, PNET, start here. They represent less than 5% of pancreatic cancers. These tumors tend to be less aggressive and have a better prognosis. Symptoms include heartburn, weakness, fatigue, cramps, weight loss, digestive problems. Overall, symptoms of pancreatic cancers involve the hindrance or inability of the body to digest food, specifically fat, or to regulate glucose, so the body kind of wastes down. Diagnostics. There is no standard test or screening for pancreatic cancer. Tests are expensive and not usually conclusive on their own. So doctors generally recommend a combination of tests. For patients with a family history of pancreatic cancer, genetic testing looks for inherited mutations. This type of screening is not recommended for the general population. Imaging tests, guided endoscopy, and biopsies can show the condition of the pancreas and tumors that are large enough to see. Blood tests can show tumor enzymes and cancer markers. Treatments. Treatments are targeted toward the type and stage of cancer. The only way to completely cure pancreatic cancer is to surgically remove the entire tumor. Many tumors involve necessary blood vessels or ducts, and when the pancreatic cancer spreads, often the tumor is inoperable. If the entire pancreas is removed, doctors will need to provide lifelong monitoring of the patient and provide treatment to replace the digestive enzymes and hormones the patient can no longer make. Chemotherapy and radiation can shrink tumors and kill cancer cells. Targeted therapy can prevent specific cancers from continuing to grow. Doctors will provide pain management and palliative care to improve quality of life. For example, stents can relieve blockages. Because of the low survival rates for pancreatic cancer, doctors often prescribe palliative care. But no one is giving up. Research continues for prevention and treatment for pancreatic cancer, everything from immunotherapy to vaccines. Pancreatic cancer patients often participate in clinical trials for new treatments. On the federal level, the United States Congress has some legislation in front of them to secure federal funding for pancreatic cancer research, plus testing and treatment coverage. Please let your legislators know that they need to take this seriously. It's time to increase our efforts to prevent, diagnose, and treat pancreatic cancer. So stay diligent, talk with your healthcare team about any risks, and ask for suggestions. Check on your people. Please like, subscribe, and share this video. Comment something useful because none of us have time for nonsense right now. Stay safe. I'm Wanda Frazier. This is Your Body and You.